Hi there. I'm so excited to welcome you to the Arthritis Life podcast, where we share arthritis life stories and tips for thriving with autoimmune arthritis. My name is Cheryl Crow, and I am passionate about helping people navigate real life with arthritis beyond joint pain. I've been living with rheumatoid arthritis for 20 years, and I'm also a mom, occupational therapist, video creator, support group leader, and I created the Room to Thrive self-management program. I am so excited to help you live a more empowered life with arthritis. We're going to cover everything from kitchen life hacks to navigating the healthcare system to coping with friends who just don't get it. Seriously, no topic is going to be off limits on this podcast. My interviewees and I share our honest stories of how chronic illness affects our lives. This includes discussions about mental health, sex, shame, pregnancy, body image, advocacy, self-acceptance, and so much more. You'll hear stories from all ends of the spectrum, from a person who's living in medicated remission from psoriatic arthritis to somebody living with severe mobility restrictions and severe pain from rheumatoid arthritis. You'll hear how people manage their conditions in different ways, like medications, mindfulness, movement, social support, work accommodations, and so much more. You'll also hear from rheumatology experts who just get it. We'll dive deep into the science behind chronic pain and what's the latest evidence for lifestyle changes that can help you thrive with arthritis, including exercise, sleep, nutrition, stress reduction, and more. This is your chance to sit down and chat with a friend who's been there. Ready to figure out how to manage your arthritis life? Let's get started. Today, I am so excited to have rheumatologist Dr. Jenna Thomason on the Arthritis Life podcast. Welcome.
Thank you. I'm so happy to be here. Thanks for having me.
Yes, we've been talking about this for a while. And so could you let everyone know, where do you live and what is your relationship to arthritis? However you interpret that question.
I live in Seattle and work in Seattle, and I'm a rheumatologist. So I spend most of my time at Harborview Medical Center, and once a month, I work in a combined rheumatology dermatology clinic at the UW Roosevelt Clinic. And my clinical niches include rheumatic diseases with dermatologic manifestations, systemic lupus, erythematosus, transitions from pediatric to adult rheumatology care, and also chronic non-bacterial osteomyelitis and the subsets of that, which are chromo and Sappho syndromes.
Wow, I hadn't even heard of those. That's what's wild about rheumatology is there are so many rare, or I don't even know if that's rare. I just hadn't heard of it. There's so many.
Yeah, it's rare, more common in pediatric patients.
Okay, yeah, and I'm just really excited to have you here. We're going to talk a lot about like the transition from pediatric to adult care, but we're also going to talk about other helpful things from your wealth of experience. And when we say UW, I always try to like define acronyms and stuff. That's short for University of Washington, by the way. So if anyone's listening, like, what's a UW? I always wondered I wonder if the University of Wisconsin also calls their.
I think they do.
Yeah. So we're talking about when we say UW, we're both in the Seattle area talking about University of Washington. So before we get into like the topics of the day, I always like to know what inspired you to become a rheumatologist in the first place?
Yeah, so I would say like choosing a medical specialty was really tough for me. I actually published a little essay about that when I was a medical student because I really struggled. And I look at it kind of as a series of branch points. When I was a medical student, I was trying to decide between pediatric and adult care because I really love kids. But the thing that really drew me to adults was that I really loved hearing people's stories. And then I also loved dermatology, but what I really loved was dermatologic manifestations of underlying systemic disease. So I ultimately went into internal medicine and was considering several subspecialty options subsequently, but I was really drawn to rheumatology for a few reasons. So as rheumatologists, we're so fortunate that we develop these really long-term relationships with our patients, and that was something that was so valuable to me. Also, you might say like, oh, that's what a primary care doctor does too. But I think one of those branch points is deciding, do you want to know a lot about one thing or a little about many things? And to me, I really wanted to know about a lot about a sort of more narrow area in internal medicine. And then again, I love the diseases that have derm manifestations and other physical findings. And so for me, rheumatology was, I think, kind of ultimately a natural choice, and I have loved every minute of it, and I have not looked back. So
That's amazing. I think I was trying to think if you're somewhere between the 10th to 15th rheumatologist I've had on the podcast, maybe even 15th to 20th. And I always love hearing why people are drawn to rheumatology. And it's usually the mixture of that long-term relationship, really being able to dive deep with your patients, and the medical mysteries.
Oh yeah, getting to essentially
Yeah.
be a detective sometimes.
Exactly. Yeah, yeah. And yeah, I have like a million follow-up questions, but I do want to make sure we have time for the topics
Yeah,
of the day. But I
yeah,
would say one quick question is like I think as a patient and as a support group leader, I think one of the hardest things to cope with is like uncertainty and ambiguity. And like I think having a chronic or having a rheumatological disease like rheumatoid arthritis, which I have, from the start, from the word go, it's actually so much uncertainty because
mhm,
you have this specific diagnosis, but there's a diagnosis of exclusion, right? Where it's
yeah,
not like the silver bullet, like for diabetes, like your fasting blood sugar was X, you have diabetes, like there's no question, right?
mhm,
Whereas for like us, it can be really hard to wrap your head around. And just, yeah, it's one of the harder things to cope with, whether it's uncertainty about even your underlying diagnosis, and then also uncertainty about your treatment plan. Like these meds usually work, but sometimes they don't, and you might have to
yeah.
do trial and error. How do you cope as a rheumatologist with all that uncertainty? If you have ever felt completely lost or utterly alone while trying to navigate real life with rheumatic disease, listen up. I am here for you. I created an educational program to help you go from overwhelmed to confident, supported, and connected in a matter of weeks. And it's called Room to Thrive. After earning a master's in occupational therapy and completing hundreds of hours of additional training, I created a step-by-step guide to help you truly thrive with rheumatic disease. This is the only program I know of that's designed to improve quality of life for people living with inflammatory, autoimmune forms of arthritis, like rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, non-radiographic axial spondyloarthritis, Sjogren's disease, and more. During the self-paced lessons, you'll learn how to manage pain and fatigue, cope with stress, navigate relationships, and continue doing the things that matter to you and bring you joy. The goal is really to help you improve your quality of life and learn how to thrive with your rheumatic disease right now, rather than waiting for a distant day when it might be cured or healed. I really created the down-to-earth, practical, heartfelt resource I wish I had had when I was first diagnosed at age 20. If you want even more in-depth support, you can join the 12-week Room to Thrive virtual support group, where you'll be surrounded by people who actually get what you're going through, people who will provide the encouragement, validation, and support that you deserve. Each group is expertly moderated, so you don't have to worry about the kind of misinformation that spreads like wildfire in the free-for-all social media groups. If you're on the fence, don't just take my word for it. Here's what Katie had to say in March 2023. I was lost and overwhelmed with my RA diagnosis. It felt overwhelming to know what to read, what to do, how to spend my energy trying to research on the internet. Room to Thrive did that for me. It's been like getting a crash course in my diagnosis along with a community who gets it. To see all the details, including the dates for the next support groups, go to the link in the show notes or bit.ly/thriveroom with a capital T and capital R. You can also just email me anytime at info@myarthritislife.net. And don't delay if you're interested, because each group is capped at 16 people or less in order to make a small, intimate group atmosphere. Thanks so much for your time, and I can't wait to get started with the next groups. And I can't wait for those of you who are interested in the self-paced option to go ahead and join that at any time. Bye-bye for now.
Yeah, that's tough. I mean, I think we get, I think like as a rheumatologist, become a bit more like comfortable with uncertainty and like living in the gray, which is something that I think
Yeah.
all of us have had to learn like during our training. And you're right, there is that at this point, we're still living with uncertainty even about like what specific treatments will work. And I'll tell patients that all the time um, when it comes to choosing the next medicine. I tell them, like one day you'll come into my office, we'll do a blood test, and it will tell us like this is the inflammatory pathway that we should block, next in Cheryl's treatment or whatever. And we don't have that yet, but we have come so far. Another thing I tell people is that I want to offer like a little bit of hope when they are diagnosed with these conditions, because we do have so much more to offer than we have historically. I tell them, if you were being diagnosed with this condition, like, say like in the 80s or even like the 90s, like we just didn't have like nearly as much as we have to offer today. Um, and so hopefully that does provide some hope for patients.
Yeah, I remember my doctor having that exact conversation with me at my very first diagnosis appointment. And she said, and it really left an impression on me that like this is the best time in history to have been diagnosed with one of these conditions. That was the case in 2003, and it's even more practically the case now in
Oh yeah.
2025. There's so many more
Yeah.
treatments. So is there anything else that you wish patients knew, maybe either about rheumatologists in general or about your job? It's just honestly, I'm not trying to lead you into anything. I'm just curious.
Yeah. Yeah, I don't know. I mean, yeah, I would say like most rheumatologists are like such most of the time like very, very kind people. And like we were saying, they're like detectives. Like they're typically like these very like cerebral beings and sort of interested in not only diagnosing your condition, but figuring out the way to treat it that helps maximize your quality of life and all those things that are important to you.
Yeah, yeah, I think that's true. And I think one thing I tell patients sometimes, I don't know if you do too, but is that like your rheumatologist does not have a crystal ball,
Yeah.
like but they're very informed as to their recommendation. But it's not like sometimes I think it feels to patients like they just don't want to tell me what's gonna work or something. Like they're worried that the rheumatologist is just being obtuse. But I'm like, no, like, they literally don't know. Like,
Yeah.
does that
Yeah.
make sense?
Yeah.
Like, are
Yeah.
your
Yeah.
patients sometimes confused? So they're just like, just tell me what to do. Like, tell me what's gonna
Yeah.
work. Yeah, yeah.
Yeah. Yeah. People take definitely like people sort of have different ways that they kind of like approach that uncertainty too. I have some patients that are like, whatever you decide, that was what I will do. Whereas
Yeah.
other patients, like they want to like have like way more like back and forth and engagement, negotiation,
Yeah.
and conversations about where to go. But yeah, it
Mm.
can be uncomfortable for everybody living with
Yeah.
that uncertainty and gray.
Yeah. And that's what's all the more reason to see. The other thing I tell people a lot, and then we'll go to the other questions, but is that your rheumatologist is like on your team, like on your
Oh yeah.
side. Because it
Yeah.
can navigating medicine can feel like combative to some people because they're like, oh, there's all these barriers. Like I can't get in for 3 months or 6 months or eight
Yeah.
months. And it feels like it's us versus them, which I would
Yeah.
say sometimes is the case with insurance. Don't quote me on that, but
Yeah.
y'all know it.
Yeah. Yeah, yeah, 100% on your side. And it's so, I think, important to be like really honest about how things are going, like how adherent you are to your medication regimen, because like sometimes like um, someone may feel like they're kind of letting their doctor down or something, like if they're not being 100% adherent to their medications. But often like there's things that we want to explore. Like, are you having side effects from the medications? Are there ways that we can adjust it to make it better? Like for instance, like methotrexate can be very difficult to tolerate. But we generally have ways that can help people, like split dosing. So you take part of your dose in the morning, part in the evening, or using subcutaneous methotrexate, or sometimes increasing folic acid, like lots of strategies. Or say people are not injecting their subcutaneous medicine because they have like a needle phobia. Like maybe we could figure out, how to switch to one that's less frequent, or to infusions or oral medicine, or there's so many. We're so fortunate. We have so many strategies available to us. So it's so important just to lay it all out there and figure out how you like together can work to really maximize your treatment plan and quality of life.
Yeah. I mean, I think I'll say this as like a person who's been the victim of my own, what I would say, wayward optimism, is that like it is so important to be, because I'm never the kind of person that would be dishonest for like reasons other than like my own denial. You know what I mean? Like
Yeah.
the
Yeah.
first time a medication failed me, I didn't understand what was happening because I was like, insanity is doing the same thing and expecting a different result, right? Well, I'm doing the same thing. I'm injecting my Enbrel every week, exactly how I always have. And I'm suddenly feeling worse, but I didn't know why. And so I kept thinking, oh, this must just be, maybe it's stress. Maybe I didn't sleep well enough. This is just, I'm getting older. I'm like 27. So then I finally told my doctor, she's like, how are you doing? I'm like, I'm fine. I mean, it's like kind of weird that my fingers are like kind of hurting, but not really bad. Not a big deal. Not a big deal. And then
Yeah.
finally, when I told her, she like explained that your immune system could change and adapt and create antibodies potentially to the meds, or just like the meds can, for whatever mysterious reason of what's going on in my body, they can decrease in effectiveness. And I was like, oh, if I had known that, then, I mean, first of all, if I'd just known that to begin with, I would have been more on top of it. But so it's all the more reason to have that like kind of open communication
Yeah,
channel.
totally.
So yeah. So we're going to talk today about the transition from pediatric care to adult rheumatology care, which is a big change for people. So first of all, just what is the difference? Why can't I, as an adult, go to pediatrics? Because I like being around kids and they're fun and their facilities are always bright and colorful and more fun. Or why can't kids go to the adult rheumatology? Just what's the difference?
Yeah, I mean there are some important differences. Of course, age being probably the most
Yeah.
important one.
Your literal
But
joints are different when you're growing. Yeah.
that's so true. Yeah. So pediatric rheumatologists generally see patients typically up to age 18. There are some reasons why patients might transition to adult care earlier or later. Also, the diseases themselves are a little bit different in the pediatric world. Treatments can sometimes be different as well. And then there's a lot of important differences kind of like in the, I would say, like approach in pediatrics versus adult care. And that's there was this beautiful paper that was written a few years ago by Sarah Bayevsky, Kimberly DeQuatro, and Rebecca Sadoun, where they go through the differences between peds and adult care. And Dr. Sadoun she's a med peds doc who's trained in rheumatology, so she has like this wonderful perspective in looking at the two sides. And then also I put in a plug for our video that we made, which I think
Yes.
Cheryl's going to share, where we was essentially animated versions of myself and one of my colleagues, Cindy Chu, where we also talk about differences between pediatric and adult care. So some of like the big differences that we talk about are just like the appearance of the clinics. So like it's much more pleasant to go to a peds room clinic. There's usually like, like sea creatures on the walls and
Yes.
it's like beautiful and colorful. And then like you come to our clinic and like literally everything is beige, like some like shade of beige on like the floors, the
Mhm.
walls, the curtains. So that's the first difference people notice. And then also in the waiting room, sometimes you might see older patients. Also the length of visit can be different. So in the pediatric world, patients generally have longer visits. When they transition to adult care, depending on which clinic you go to, there may be like shorter visits. So we're so fortunate. We have 60-minute new appointments, 30-minute follow-up appointments, but often in the adult world, the rheumatologist may only have like 40 minutes for a new visit, or even like 15 or 20 minutes for follow-up visits, which is tough. Also, the approaches to screening are often different in the pediatric versus adult world. And I think a lot of that has to do with, like, once you are in the adult world and you are maybe have more ability to kind of express what's happening with your body, like you're able to tell us more about what's going on, and then we generally do certain testing based on symptoms. Whereas in the pediatric world, for instance, systemic lupus patients regularly, pretty much every year, get an echo, pulmonary function test, and other things. Whereas again, in the adult world, we're more focused on evaluating those things if they have patients have certain symptoms. Also, one thing I think is scary for patients is they are sometimes told that in the adult world we will sometimes tolerate low disease activity. In the peds world, patients are like treated very aggressively to like stamp out any evidence of active disease. But as patients like get older and older, sometimes the treatments carry a little bit more risk for patients as they get older and maybe accumulate more comorbidities. So there are times when a patient might have low disease activity, and we tolerate that rather than sort of revving up their disease regimen.
Yeah, yeah. And to people who may not, maybe are like the more newly diagnosed, like when we say low disease activity, we mean like you still might have some clinical markers of disease, like in your blood work or in your like tender joint, swollen joint count, or your subjective experience of your disease, like having some lingering pain or stiffness, like versus the remission, like trying to give the people the right, quote unquote, the amount of treatment, which is usually the medications that are going to put you into full remission, where you're like, don't even look like you have the condition anymore. Would that be right to say?
Yeah, that's right. And then, usually like tolerating low disease activity is like usually a shared decision, like between the patient and the provider. Like, generally not letting people have active disease if it's causing them significant pain or interfering with quality of life. It more like the patient might say, like, I might feel some swelling on exam, and the patient's already on meds, and like they feel like they're doing really well, and they're like, I don't want to take more meds, I don't want to take different meds. And in that case, we're just kind of monitoring things over time. So there are a few different scenarios in which that can come up. Also,
I think,
go ahead.
Sorry.
Go ahead,
I was just going to say, because I used to work as a pediatric OT, and I think in our occupational therapy evaluations, it's very much like family system based in the sense that you have to, especially depending on how young the child is, you're asking a lot of questions to the adult to say, okay, like let's say you have a 2-year-old that stopped suddenly walking, or is limping, or is crawling differently. And obviously like the 2-year-old can't be like, I have bilateral joint pain, like you have to see what the, observable behavior is. And whereas adult, it's more like a one-on-one relationship where you're not
exactly. I think you're hitting on like the most important difference really is like, the care is really centered on the patient, rather than, and patients are welcome to bring like whatever they would like to their clinic appointments, but we're generally directing questions at the patient. And sometimes, like if you are a young patient and you bring a parent with you, then we might even ask them to step out so that we can have like private conversations about things that you may not want to discuss in front of your parent.
Yeah, when I was diagnosed was 21, and I had my mom at my appointments because I had become I was just really sick, like, and I had lost like over 10% of my body weight, maybe even like 15%. I was just like, I felt like I couldn't think clearly, like the brain fog and fatigue were so bad, and I didn't know what was happening. So I really needed her there, like as an extra brain. You know what I mean? I mean, and I needed her emotionally, but also like, please, like these are complex conditions to begin with, and I'm not at my best right now. So I was really
Yeah.
lucky that I wasn't treated poorly by rheumatology for having her there. I was, anyway, that's a listen to episode 100 if you want to hear the ups and downs of my medical journey, but because I interviewed my parents on that
Oh
episode
yeah.
and they shared, and yeah, one of like gastroenterologists like said something really weird about how like he thought that I was like too attached to my mom or whatever. I'm like, sorry, I have a supportive
Interesting.
family.
Yeah.
Like, anyway, that's my story. But what else were you gonna say when I said the thing about like the kind of family based care?
Yeah, just like also the do you feel like the expectations in terms of like um coming like to appointments on time and refilling your own medications and things like that are can sometimes feel like a change when you're transitioning to adult care as well.
I think the other thing that surprised me, I honestly didn't know this because I was diagnosed by an adult rheumatologist as an adult. Um, I didn't know that pediatric rheumatologists, they are pediatricians. They are pediatricians who are then,
Yeah.
this is not obvious to regular people. So they're pediatricians who then specialize in rheumatology,
Yeah.
whereas
Yeah.
rheumatologists are adult internal medicine.
Yeah. Yeah.
That is
Yeah.
a
Yeah.
totally different basis of your training, right?
Yeah, it is. Yeah.
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 So it's just good to know that pediatricians are trained in child development and all sorts of other things that are not that like, all doctors are trained in like the basics, right? But
Mhm.
it's just it's a different and it's a different, I would just argue like kind of maybe personality type in the type of physicians who sell or medical students who self-select into pediatrics
Mhm.
versus like
Yeah.
internal medicine
Yeah.
and but I've still found that I mean I think rheumatologists are amazing and like but I'm like a big kid at heart so I also love like pediatric rooms too so
Yeah, yeah.
yeah
Yeah, me too. That's how I got this gig doing
yeah
transitions. I actually, when I was a fellow, rheumatology fellow, in my second year, we do kind of several rotations, and one of them is going to hang out at Children's with the pediatric rheumatologist.
yeah
And so I got to hang out at Seattle Children's, and I loved it. I loved it so much. And they deemed me a peds-like adult rheumatologist, and they started sending their patients to see me in clinic. And so that's kind of how I got this gig, and I love it. I feel so fortunate.
yeah well that dovetails perfectly in my next question which is yes so when patients transition what let's say on average age 18 from going to their pediatric rheumatologist to the adult rheumatologist what why is that transition hard? I mean obvious it's probably not obvious but what are some of the things that make that transition
Yeah.
hard and then what are the things we can do that to make it easier for them?
Yeah. So I think it really the difficulty depends on the patient themselves. Some of the things that have come up are that some patients with childhood onset rheumatic disease, they may have been diagnosed like when they were super young, and we're asking them questions. They come in for their first visit, and we're asking them questions, kind of about their disease, and they may not remember like the beginning, and they may have had like a lot of help managing medications and stuff like that, and suddenly they're being asked to manage their own medications and get their refills and that kind of thing. Um, so other things are like just that time in your life, like when you think about like when you're 18, like you might be like going off to school or starting your new job or having like, serious relationships or, um, managing health insurance, which is like extremely difficult, unfortunately. Maybe moving to a new place. So just there tend to be naturally a lot of transitions during that period. And so it's a lot for somebody to also be transitioning their doctor at that time.
Hmm.
Um, and in terms of things that we can do to help, so that's what we're trying to sort out. We've been doing a little survey study in the past couple of years to try to figure out how we can support young people better. And I will say, like, the majority of research about pediatric to adult transitions is done on the pediatric side. And we know from that type of work, like it's really good to introduce the idea of transition early on. So maybe like even like around like age like 12 or 13, which can sometimes feel early for patients, but it's good to start thinking about it and kind of gradually letting patients have more autonomy, from their family in terms of being the person that is doing the speaking at the visit, and taking their medications and that sort of thing, so that when it does come time for transition, that they will feel ready. Questions that we're trying to explore in our surveys, like, are these patients, if they have adequate information about reproductive health in terms of, are they on teratogenic medications? Have they had access to contraception? If they are capable of childbearing? Also, like, do they want us to ask about, like mental health and how that is affecting their life, if it's, related to their rheumatic condition? And also, right now we are offering some like transition coordinator support for patients to see how engaged our folks with childhood onset rheumatic disease will be with a transition coordinator, to see if that is going to be something long term that's going to be helpful to those patients.
I love that idea, like having a transition coordinator.
Yeah, like just someone that's available to answer questions about various things. And then the last thing, like, that I personally think is really important, is for patients that, because as you know, like a lot of patients are lost to follow-up around the time of transition. And something
And
that I
lost to
think,
follow-up means that they don't continue going to get care, right?
yeah, they don't get going to get care, or it may be like a really long time before they seek care in the adult world. One thing I think is really important is, as they are arriving at the time in which they will transition to adult care, after they have identified an adult rheumatologist, made an appointment with that person, if that patient is like a higher risk patient, say like they're on, multiple medications, or their disease is active, or it might be high risk for social reasons or other reasons, actually making that appointment with the adult doctor, but then making a subsequent appointment with their pediatric doc. And that way, like, if they don't make it to that adult clinic appointment, or like say maybe it doesn't go well, like it doesn't feel like a good fit, then they're still circling back to their peds room doc, so that we can ensure that we're keeping them engaged in care.
Yeah. That makes a lot of sense. And I think one thing I read, and I should fact check this, but I'll just ask you, because you can fact check this, is that is it the case that like juvenile idiopathic arthritis, let's just take that one condition, or that set of
Yeah.
conditions, is more likely to go into remission? I know not all childhood like rheumatic diseases go into like long-term remission, but isn't JIA more likely to go into remission than like adult rheumatoid arthritis? So,
Yeah, certain types of JIA, yeah, can
so
go
I would
into
imagine if you
remission.
were somebody who was in remission at the time you're 18, I've heard people in my support groups, like people in their 20s or even early 30s, will say, well, I kind of thought I was done with this because I had, whatever subtype of JIA, and then, or juvenile ankylosing spondylitis or juvenile psoriatic arthritis. And then I was feeling better, and just, I thought it was going to never come back. And then it did. Is that, is that just like freak occurrences that I've seen, or is that something you've
There are
seen?
some kids, yeah, some kids, depending on their type of arthritis, can go into remission.
Yeah.
Yeah,
I mean, adults
thankfully.
can too. That's what's kind of cool too. I mean, obviously we can go to medicated remission, but some go into like spontaneous remission, even unmedicated, right?
Yeah, some, like, depending
Yeah.
on your type of inflammatory arthritis. Yeah, less likely, with rheumatoid arthritis, but some other types of like seronegative inflammatory arthritis, reactive
Mm,
arthritis could go into remission. So
that's
yeah,
the,
but we hope that that's going to be, more of our future, is like actually having people go into remission. So we'll see.
yeah. 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 Sorry. I didn't mean to like take us on derail, but I think that's a really, I can imagine like, the idea of being lost to follow up, or just like not continuing being seen, totally can make sense if you're like, it's your first time being on your own, you move to go to college, you have all these new responsibilities, you have your first credit card, you have your first freaking
Yeah.
job, you're managing your college schedule and you're like, oh, I'll make this appointment later, or
Yeah.
the doctor says you have all
Yeah.
these months to, you can't do it for X number of months. And you're like, oh my gosh, so, so, I know you've done lots of research, on this. I remember you presented at the rheumatology conference last year, which doesn't seem like that long ago, but it was apparently in November of 2024. And is there anything else you wanted to share, like just about transition in general, or about the work that you do? Because it does sound so fascinating to me.
Um, yeah, it's been super fun work, and I'm so appreciative to all the patients who have filled out our surveys and told us what they think about all of these things because like I said, historically this work has really been done on typically on the pediatric side, and we haven't heard
Mhm.
much from patients after transition. So I'm so grateful to them. And then one of the things that came up and in our initial group was wanting to really know more, exactly what you asked me, like the differences between pediatric and adult care.
Yeah, yeah.
And so we actually made, and I mentioned this earlier, we made some videos for patients that
Nice.
talk about a transition timeline and then also differences between adult and pediatric rheumatology care. And then we also had one of our amazing patients with systemic lupus who gave us her patient testimonial, which was so wonderful. And I think
That's
Cheryl will link to all of those.
Make sure to watch the videos. Yeah,
Yeah. Yeah, and
that's
I
huge.
guess one other thing, I think something that I think is important that I've heard from others is for that initial visit with your new adult doc. Like generally we aren't and often like should not make a lot of changes on that visit. Like that's really more of a visit kind of to get to know the patient and get to know their history and maybe even get to know like where they're at in terms of like independence and managing their health and generally we're not making a lot of changes during that visit unless there's something wrong that we need to address. And I think that generally a team seems to go over better with the patients because
Mm,
often they're on a regimen that they have sort of developed with this other person that they have this like often long-standing relationship with. So it's really
mhm.
more of a meet and greet that first visit.
Yeah, that makes a lot of sense. And you mentioned kind of earlier that they might not feel that the first adult rheumatologist they meet might not be the right fit for them long term. Like, what's your opinion on people getting like second opinions? Like I
Yeah.
think some people they tell me they're scared to get a second opinion because they don't want to offend the doctor that they saw, or they're worried they're going to be labeled as like a difficult patient.
Oh, yeah. Um, so I don't think they should worry about those things. I don't want
Good.
them to worry about those things because like it hopefully, should be a good fit for them. Again, like it's such a delicate time in their life and a lot of transitions happening. And so I don't think that they should feel too concerned about being labeled as those things.
Like it's okay to get a second opinion, in your opinion,
Yeah, I
or
think
like
so.
try a different doctor. I think so too.
I think
I want
so.
them to hear it
Yeah.
from you because I've said it before.
Yeah. Yeah, no, I think so. Our just from like a logistical standpoint, our because there are so many like referrals to see rheumatologists now, it can be difficult to get a second opinion in general, just because of our, in the Northwest, we have a deficit of rheumatologists um, and a lot
Yeah.
of patients. So that can make that aspect difficult. But I think for transitioning patients, it's sort of a unique situation.
Yeah. Yeah. And I think like if it is going to be a long-term relationship, if there for me, I mean, I got so lucky. I had a home run with my first rheumatologist. I met, and it wasn't even from any research. It was just the one that my primary care referred me to.
Oh,
It was
nice.
fresh out of UCSF. So she was young, relatively young, and I was like, okay, well, you're like 10 years older than me. So I'm like, I'm going to stick with you forever. But But if I didn't, yeah, if she was like, unfortunately, rheumatologists are generally amazing, but some of the stories I've heard, sometimes if you're in a support group leader role, you obviously are sometimes hearing like the best and the worst case, scenarios. And sometimes if you don't feel comfortable, like, or you don't feel like your doctor's really partnering with you or listening to you, it's in your best interest to see if there's another option in your area. Again, there's not always, if you're rural or depending on your insurance and all those other things.
Yeah.
Um, the other fun question I like to ask whenever I have like a subject matter expert is, are there hot topics in your field, like in the field of rheumatology that or just like scientific developments and discoveries that you're excited about?
Yeah, for sure. Yeah. So I think everyone's really excited about CAR T.
Can you tell them what that is? We've kind of
Sure,
referred to it before,
yeah.
but not recently.
Yeah, sure. So CAR T is essentially it's a type of therapy that was first used in treating cancer. And what they do is they take or currently what they do, they're sort of it's evolving over time, but currently what CAR T is taking your own cells and actually taking them out of your body and then actually weaponizing those cells against other cells in your body that are sort of causing or sort of underlying an underlying cause of your immune disease, and then giving you medicine to kind of lower your immune system in general, and then giving you those weaponized cells back into your body, and then
Oh, sorry, your audio cut out.
lupus and
Oh,
uh-huh.
so your audio just cut out for the last like 5 seconds for some reason. So I
Oh,
got
okay.
so you give you the meds to lower your immune system, and then what happens? Sorry.
So so um so they take your cells and actually weaponize them against a different type of cell in your body that's sort of involved in causing your autoimmune disease, give you medicine to lower your immune system for a brief period of time, and then give you back those weaponized cells. And they go in and they basically wipe out any trace of your autoimmune disease.
Uh-oh, you
And
froze.
uh-oh.
Let me stop.
So CAR T is an amazing new therapy on the horizon. It's currently being studied in clinical trials. The strategy of CAR T initially was used in, or has been used in treating cancer. So what they do is they take patients with an autoimmune disease, typically a severe autoimmune disease, and so far they've been studying, lupus and myositis and other autoimmune diseases. They take the patient's own cells, their T cells, and they essentially weaponize their T cells against a different type of cell inside their body that is sort of involved in the causing their autoimmune disease. Then they give the patient medicine to lower their immune system briefly for a brief period of time. And then they give them back those weaponized T cells, and the T cells go in and they kill off those cells that are involved in causing your autoimmunity. So these patients that have had CAR T therapies so far have done really, really, it's just been absolutely amazing. It is um, it's given us like hope for a cure for severe autoimmune disease, which is just absolutely, it's really mind blowing when you look at it, because these patients, their immune system starts to come back, in a matter of weeks, but there's no trace of their autoimmune disease. So like all of their antibodies against lupus are gone. Their
Unbelievable.
yeah, their like renal disease is halted. So there's been a lot of success so far, and there are a lot of ongoing trials to try to make it, safer, make it more affordable, because that is definitely an issue. And so we'll see, but I'm really excited about CAR T cell.
I am too. I mean, gosh, yeah, being able to not being immunosuppressed, long term would be incredible, so
Yeah.
I'm definitely following that. And I saw so much excitement at the conference, even though it's outside of my domain, like as an occupational therapist, of course, because we're not like doing those kind of interventions. But as a patient, I'm like, I want to learn about this.
Yeah.
Yeah, yeah. And so Oh, there's a great doctor who I saw on Twitter. He's a real doctor, so it's not like a fake thing. He has like it's the guy who does the Lupus Encyclopedia. Do you know him? Um, he has a website called like the Lupus Encyclopedia. And he has a thing on his website all about CAR T. So maybe it has like a area where you can find out about clinical trials for CAR
Oh,
T.
awesome. Oh, that's
Yeah.
awesome.
So let me look into that right now. CAR T cell therapy for lupus made simple. January 2025 update. It's
Oh,
Dr.
nice.
Donald Thomas.
Oh, nice.
Okay,
Yeah, the
so
Lupus Foundation has a nice description as well on their Lupus
okay,
Foundation of
awesome.
America website.
Awesome. I feel like with some of these things, I just have to like just being honest, like I'm a smart person objectively in some ways, but also I'm like, wait, tell me again. Like that part in
It's pretty
Zoolander where he's like,
mind-blowing. Like it's
I'm like,
pretty hard to wrap your mind around that
yeah,
idea. Like it's pretty wild.
I know.
You're not alone.
It feels like too good to be true. So I'm like, wait, how?
Yeah. Yeah,
Yeah,
exactly.
yeah.
It's so
So I know
amazing.
unfortunately I am in touch. I mean, fortunately in a position to support a lot of people, but unfortunately for them, I'm in touch with a lot of people who have had like who are very like treatment resistant,
Mhm.
disease, who ever have failed, all like 9 medications for RA in 1 year. And it's heartbreaking when you feel like you're getting to the end of the road. Like there's no new treatments, there are no more treatments to try. But clinical trials are kind of like they're not like a lot of patients I think tend to think of clinical trials as this fringe thing. And honestly, I did initially. I was like, yikes, I don't want to go to a clinical trial. They're gonna like treat me like a lab rat or something. Like this is the incorrect thing. Like it's
Yeah.
by the time clinical trials get to human subjects, they've
Been
been
like just rigorously tested. Yeah.
yeah, yeah. So I mean, it's obviously human to be scared if you're, trying something that's maybe not. I mean, even the drugs that are on the market, people are still scared to take those. So
Yeah.
there's like a amount of fear that people just have, like injecting or putting anything in their body, except for untested supplements. But anyway, let's not worry about that.
Yeah, yeah, yeah. True.
That's just humans, like
True.
as Dan O'Reilly says, we're predictably irrational. We are not always rational. But so I will definitely keep an eye out for more on CAR T. Or CAR T. I keep calling it CART T. My brain adds like an extra T. I can't believe we've gone through like 45 minutes. So we haven't talked about Taylor Swift yet. Just side note, we're both Taylor Swift fans. So I'm
I think
wearing my
I think I think we may have been at the concert the same day. We're like
yes.
so lucky we got to go to the concert.
I know. Now it's almost 2 years ago now in 2023. But
Crazy.
yeah, for those of you who are also Taylor Swift fans, I'm going to plug my own episode. I did an episode like all about like Taylor Swift songs that like help me cope with chronic illness. So that was, I have to look it up right now. Episode 113. Of course, it's episode 113. So I
Yeah,
know a
nice.
13 in there.
I also saw one of your episodes where you did some like exercises to down bad, and
Oh,
I
yes. Yeah, yeah. Yeah, yeah.
I
That was on the
liked that one.
airplane.
Yes, yes,
And
yes,
ascending
yes.
gliding. Yeah, that
Yes.
was really fun. Yeah, that was really fun. Um, but so we're on to the rapid fire questions. Do you have any best words of wisdom or advice you'd like to give to people who are brand new diagnosed? Brand
Yeah,
new.
I guess like more of what we were saying about just like what you said, like this is the best time in history to be diagnosed with your condition because we have so much more to offer than we have and patients often, by the time they receive a diagnosis of, say, rheumatoid arthritis, but before they see you, they've Googled photos of rheumatoid arthritis, and you can see like these horribly destroyed joints. And thing is, like, fortunately, like in our country, it's unlikely that patients progress to that point if they're able to access medical care and medications. It really, really, really has changed the trajectory for patients.
Yeah, it's really, I think when you're comparing yourself or predicting how your future will be with your condition, you really have to be careful to do apples to apples, meaning like your prognosis as somebody diagnosed in 2025 is very different than somebody diagnosed in like 1985, right? Who
Hmm.
had years of disease progression because there weren't any treatments or medications to put the disease in remission back then, so people will often say like, is this my life? Like, is this, and again, not to say that you can't have a possibility of leaving, I try to maintain the perspective that we can have a good life even with disabilities and challenges. That's like kind of like the
Hmm.
entire foundation of like occupational therapy as like a discipline.
Yeah.
Philosophically, it's like we're going to find a way to work around. If you don't have two hands, we're going to figure out how to do everything one-handed. If you don't have any hands, we're going to figure out how to do it with your toes. If you don't have toes, we're going to do it with your mouth. We're going to figure out
Mhm.
how to live and
Yeah.
adapt. But don't scare yourself unnecessarily that you're going to have to suffer in the exact way that someone else did. So anyway, just building on to what you said.
Yeah.
Do you have like a favorite mantra? I mean, that's too strong of a
Mhm.
word, or inspirational saying that helps you either as a provider or that helps your patients?
Yeah, I was trying to think of one.
It's okay if you don't.
Well, I so I have like one like exercise person that I find like very inspirational, and she always says you don't have to, you get to. And
Oh.
I think it's cool to think about how many things in our lives that we're thinking like, oh, I have to do this, but it's like, oh, if I just reframe it to think like, oh, I get to do this because I'm able-bodied, and
Mhm.
I've had you know, so many good things in my life that have brought me to this point. So I think it's applicable to your workouts however many times a week, but also applicable to many other areas of your life. So, and that's
Yeah.
Jess Sims on Peloton. Love her.
Oh, what's her name?
Jess Sims.
Okay, okay.
Love her
Yeah,
so
I've heard such
much.
good things about the Peloton. Um, I've only ever used it when they have one at my husband's work, which spouses can like go to the gym there, which is really a great spouse benefit. And so I did try a couple workouts just for fun, but I don't like have one at home or anything.
Yeah, I love her. She's so like motivating, and she's great. So
I think that's awesome. I have my we can do hard things. That's one I like repeat to myself.
yeah. She says that a lot too. And I say that to my kids all the time.
Yeah. It's so important, like that kind of resilience and yeah,
Yeah. Yeah,
yeah, I love it.
absolutely.
It reminds me when you're talking about kids, when you were saying earlier about like giving children and like young adult or young teens, what do they call them? Preteens and teens like more responsibility. It was interesting because my son's about to start middle school and they've already started doing these orientations and they've been saying, like you just need to start now. My kid's only in fifth grade, but being
Yeah.
like, they're like, try to let your kid be in charge and say you're in charge of bringing your instrument to school or you're in charge of your homework, not providing like excessive reminders because they have to start now being more accountable and having those experiences, which then make them experiences of like what it's like when you forget your instrument. You're the only one in the band who's
Yeah.
not playing or whatever. And then that will help as long as it's in OT, we call it like the just right challenge. Like it has to be an appropriate challenge. You don't tell like
Yeah.
a 3-year-old, like, go zip up your jacket and like tie your shoelaces. Like they're not able to do that yet,
Yeah. Yeah.
but I think as a parent, we definitely the pendulum has swung towards a lot of like helicopter. Yeah,
Yeah. 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 I
yeah.
feel that
So
too.
I remember actually, sorry, this is a side note, but I just have to say it because it's really interesting. There was research coming out of, I think it was Children's and UW that the number one most effective strategy for treatment for childhood anxiety disorders was adult parental coaching,
Oh,
even more
interesting.
effective than the one-on-one therapy with between a child and a therapist was the parent coaching. I know that was so fascinating to me. Anyway, my therapist
Fascinating.
is like he's a psychiatrist, but he's board certified in both adult and child psychiatry. So he does like he didn't actually tell me about that research, but he's specialized in OCD and like specific phobias and anxiety disorders. But I somehow I somehow found out about that and I was like so fascinated.
Hmm.
Um, because it just tells you the role of,
Yeah.
environmental supports
Yeah,
and stuff.
absolutely.
Yeah. So cool. Okay. Do you have a favorite? You may not because you don't have arthritis to my knowledge, but do you have a favorite arthritis gadget or tool in your toolbox, physical or metaphorical?
Yeah. Yeah. Yeah, I do. So I was actually going to say it not just because you're here, but hand OT. Hand OT. So hand OT is amazing. And I tell patients that hand OT is amazing because, I think you guys really think about like their whole day and challenges that they experience and what's sort of like on an individual basis how to overcome those various challenges. And I think it can be amazing for patients. And then also physical therapy, like as sort of typically like as an adjunctive treatment for other conditions that we're managing can be absolutely amazing. Um, and it's so wonderful for patients to, be able to do like certain exercises or movements that resolves like some discomfort that, and you're
Mhm.
not sort of having to take a medication that comes with potential side effects and costs and all of these
Mhm.
things. So I love those things. And then also, I frequently recommend slippers with arch support to patients that have
Yes.
trauma with their feet. I wear them and they're so essential for me. And that's helped a few patients too. So
I love that. Yeah, I have home slippers. Like they're like or not slippers, sorry. They're like flip-flops, but they're really really supportive
yeah.
and I wear them around the home and I have really high arches. So definitely with that base of the foot, those joints that are like this corollary joints to like the MCPs, like the finger
Yeah.
ankle
Yeah. Yeah.
joints. That's where like it tends to get inflamed for me with RA.
Yeah.
So
Yeah.
having that support is huge, just like good footwear in general.
Yeah. Yeah. Good footwear in general. So good.
Justify your shopping. That's what I'm
Yeah.
here for.
Yeah. Yeah. Yeah.
Yeah. But no, thank you for the shout out for like occupational therapy, specifically hand therapy is so helpful. I mean, I had someone in my support group who she's an artist and no one had she's a physical artist. Like she's making stuff with paper and she just using her hands all the time and her doctor had never mentioned this whole discipline of hand therapy and she was struggling with her hands and I've heard rheumatologists say, oh, we don't have to refer to hand therapy as much anymore because people aren't having as significant deformities. And it's like their deformities might not be as visible or huge to you, but they still might have impact on function,
Hmm.
like
Yeah.
and quality of life. So anyway,
Yeah.
so preaching
Totally.
to the choir for you.
Totally.
But and then this is not on topic of arthritis, but favorite
Mhm.
book or movie or show you have consumed recently? I should put music in there
So
too. Book, movie, show, music,
yeah.
pop culture.
Yeah. I could talk about music too. So I only get to watch movies with my kids.
Yeah.
So which is totally fine with me because I love watching movies with my kids. But we've been kind of like on this like 90s like sports movie kick.
Oh my gosh,
So
us too.
really? Okay,
Yeah.
I'll have to ask you which ones you guys have been watching, but like and it's so nostalgic, right? Like watching like the Mighty Ducks and they're like
Yep.
really into it and they're like on the couch screaming like quack quack quack.
It's so true.
Um
Ladybugs, I don't know if they're old enough for ladybugs. I mean, it's a
yeah.
little bit of gender kind of, there's issues with it that you have to kind of explain back
Yeah,
then.
sometimes, yeah, watching the 90 movies can be like a little bit of a gamble, but it gives us an opportunity to talk about it.
Yeah, yeah.
Also, The Little Giants, do you remember
Oh,
that
I
movie?
haven't rewatched. I remember, but I haven't rewatched it.
Recommend, highly recommend.
Oh, that's
And
so
Rookie of the
great.
Year, they just loved that movie.
Oh my God, this is so great. I'm getting some good ideas. Yeah.
And then they're also really into musicals. They loved Wicked, which
Mhm.
I love too. It was so great. And then we just watched there was a 2014 remake of Annie the musical.
Oh yeah, yeah, yeah.
It was
Hmm.
so good. We watched that last weekend. So lots of good movies.
Oh, that's so great. Yeah,
Oh,
we've
and
been. Oh, go on.
I was just gonna say the only like sort of new movie that we watched recently was this movie Bookworm on Netflix, which was also fantastic, and we
Oh, I didn't see
recommend that
that
one.
one. Okay. Did you watch Flow, the Oscar nominated it's kind of basically a silent animation movie with featuring a cat. Yeah.
No, we haven't. No, I
Yeah.
haven't.
It's
I'll have to
all
write that one
animals.
down.
It's really beautiful. It won best animated feature at the
Oh,
Oscars.
cool.
Yeah, sorry, spoiler alert for those listening, but this was Oscars were like a few weeks ago. Um, and it's really cute. I think it's Netflix. Yeah.
Okay.
Yeah, it's really great. Yeah, I love children's media. It's really fun.
Yeah,
We've
me
been also
too.
watching, my kid is a little older than yours, but we've been watching Boy Meets World. You remember that show?
Oh my
It,
gosh.
it actually holds up like surprisingly well. Yeah.
That's awesome.
But to be like, we pause, okay, this is what a phone looked like. You had to go like this and
Yeah.
like dial the numbers. It's really fun to look at that stuff. Even like he's finally old enough to watch some of Jim Carrey, like The Mask.
Oh yeah,
Although we have to kind of
yeah,
fast forward a couple things, but yeah.
yeah. Oh yeah, loved those movies.
Classics. Okay. And then back to arthritis. Um, this is a hard one. What does living a good life and thriving with rheumatic disease mean to you? I mean, you've talked about quality of life a lot in this so far, but what does it mean to you?
Yeah, I mean, so one of my great mentors, who I think you know, Greg Gardner,
Mm-hmm.
he had so many like wonderful, wonderful things that he would say. But one of them was like, and he, you know, he was a rheumatologist before we had medications, right? There's like this whole generation of rheumatologists that were treating patients like before we had good meds and like have been able to kind of like live through um, this sort of new um, uh, living, you know, having all the options that we have now. And he would say to patients, like, our goal is for you to not have to think about your arthritis except for like the one day a week when you give your shot or whatever. And um, that's probably not necessarily true for many patients, but I think it's a good goal, and I think it's like a real possibility for some people, and we're so like fortunate that we're in an era where that's like even like something that we're able to talk about.
Right.
Um,
That's a beautiful thing to not be just I always tell my doctor I want my symptoms to be such I'm not distracted by them on like a
yeah,
daily basis. It's just kind of
yeah.
it's either background noise or it's not there at all. Like that's ideal. And is there anything else? I know we've been talking a little while, but was there anything else that you're like, oh shoot, I forgot to say that? You probably think about it 10 minutes after we hit.
Yeah, yeah. Um, not that I can think of. Thanks for linking to the videos that we
Oh
made. I
yeah.
appreciate that so much, and I hope that those are helpful to people, and please leave us comments if you'd like. So
Oh, yes. And is there anywhere else you would want people to follow like you online versus other than the YouTube
yeah, we have
videos?
we have a UW, again, it's University of Washington.
Yeah.
UW Room Instagram account where we publish or we post things about like transition. Sometimes all of our grand round speakers are on there, and
Mhm.
various other things. And we have one of our incoming fellows is really interested in transition, and is going to make some sort of educational posts for us to put up on there. So hope
Awesome.
and stay tuned for
Yeah.
those.
Oh, one last off the cuff question. What was your favorite era at the Eras Tour, Taylor Swift Eras Tour? It's
Gosh, it's
impossible to
so
choose.
hard because I feel like it kind of like it kind of changes over time, right? Because
Yeah.
because it depends like what I'm like going through in my life, honestly, like
Yeah,
what
that's so
my favorite
true.
eras. I think like as an album, like as a whole album, I think my favorite is probably Lover, just because there's like so many songs on that album that I just love. But I love her so much, and there's like she's such like a incredible uh breadth of music and
Yeah.
genre, and I think she's absolutely incredible. What about you?
Yeah. Well, my favorite era of the Eras tour, like her performance, was Reputation for sure. I just love, especially like Look What You Made Me Do, just the way it was visualized with all those
Yeah.
like little tailors coming down and how she was like
Yeah.
strutting around. Boom, boom, look what I just strut to that song like constantly. But I agree. Like I think the Tortured Poet department set when she added that, like after we had seen the show was absolutely like incredible as well. But yeah, I mean,
I
love
know. I
all
wanted to
for
see it
different.
again just so I could see that.
I know. It was, yeah, it was really unbelievable how she managed to bring each album to life in different ways. Like Evermore is one of my favorite albums, and it was so cool to see how she like, had the kind of
Yeah.
mystical, like the orbs and everything. So I love Lover too. It was such a great, perfect one to start the show, given that like Loverfest, like her previous concert had to be canceled. So yeah,
Yeah.
we are so fortunate to be
So
raised
fortunate.
in the era of Taylor Swift. Yeah.
Yeah.
I was gonna do an obscure sorry, my brain autofilled with an obscure like Parker Posey quote, but not even related to Taylor Swift. But yeah, we are very fortunate to be living in the time era of Taylor Swift.
Absolutely.
Well, on that note, thank you so much again. I know you've had this
Thank
is like your fifth
you.
meeting of the day, so thank you for being here and sharing all your wisdom. And I hope that there'll be people not just today, but in the future listening to this episode and feeling more confident about their transition from
Yeah, I
peds
hope
to
so.
adult rheumatology. So thanks again.
I hope so. Thank you so much, Cheryl.
Yay, thank you. Bye bye.
Bye.
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 Thank you so much for listening to another episode of the Arthritis Life podcast. This episode is brought to you by Room to Thrive, an educational program I created from scratch to help you go from overwhelmed to confident, supported, and connected in a matter of weeks. You can go through the pre-recorded course on your own, or you can take the course along with a support group. Learn more at the link in my show notes, or you can always go to www.myarthritislife.net. And if you like this podcast, I would be so honored if you took the time to rate and review it. I also encourage you to share it with anyone you know who might benefit from it. I also wanted to remind you that you can find full transcripts, videos, and detailed show notes with hyperlinks for each episode on my website, www.myarthritislife.net. If you have any ideas for future episodes, or if you want to share your story or wisdom on the podcast, just shoot me an email at info@myarthritislife.net. I can't wait to hear from you.